Hi there! Today we're going to address something that needs to be a bit of clarifying. Breast cancer myth. Think of the myth as like a crowd that can hide the truth. But today we're going to clear those crowds and reveal the truth. Here is the 5 common breast cancer myths I would like to share. Let's dive into our first myth. Myth number 1. Men can't get breast cancer. A thought that breast cancer is only for women. But guess what? In 2023, it is estimated about 2,800 new cases of breast cancer in men will be diagnosed. That's right, gentlemen, you are not completely in the clear. We are not immune to breast cancer. Although breast cancer is less common in men than in women, men can still develop breast cancer. Let's understand why men can get breast cancer too. Both men and women have breast tissue as long as we have breasts. Although it is much less developed in men, this tissue can potentially become cancerous. How do men know if they get breast cancer? Breast cancer symptoms in men can be similar to those in women. It may include a lump or mass in the breast tissue, change in the nipples, like nipples discharge like bleeding oftenly, and skin change on the breast, such as limping and redness. Let's move into our next myth. Myth number 2. Only older women get breast cancer. A belief that only old women are at risk. But did you know that around 5% of breast cancer cases happen in women that are under 40? Yes, you heard it right. Breast cancer does not look at your age. They does not recognize how old are you. Breast cancer can occur in younger women due to the factors like genetics, inherited, lifestyle, and hormone changes. While breast cancer in younger women is less common in older women, we know it's not unheard of. In the early detection through regular screening and awareness is essential for improving outcome. It's important for women of all ages to be breast aware and perform regular breast exam. Self-care provider can help determine an appropriate screening schedule based on a woman's individual risk factors. Now, let's address another common misconception. Myth number 3. No family history, no risk. Have you ever thought that the breast cancers only affect those with family history? Think again. About 85% of breast cancer happen in women without a family history. This conception arises because people often associate breast cancer with genetic. Cancer is like a sneaky guest at a party you didn't invite. This case often results from change in genes due to the life twist and turn. Factors such as genetic mutations, hormone levels, and lifestyle also play a role in breast cancer risk. What is the next myth? Myth number 4. Breast cancer is always painful. Many people think that if you have breast cancer, it always hurts. This belief comes from the idea of cancer is painful. But the truth is, breast cancer does not always cause discomfort or pain. Sometimes it doesn't hurt at all. People often find it through painless methods like regular checkup or by feeling a painless lump. So while breast cancer can be painful for some, it's not always a painful disease. Our final myth, myth number 5. A lump in the breast always means cancer. Some believe that if they find a lump in the breast, it must be cancer. This myth persists because breast cancer can present with lump, but not all breast lumps are cancerous. Not all breast lumps are cancerous. Many non-cancerous problems can make lumps in the breast. This shows why it's very important to have a doctor check if you have any new or strange change in the breast. Now, we have discussed this myth. Let's reflect on the realities of breast cancer. First, breast cancer affects people of all genders and all ages. Second, family history is just one of many risk factors. Third, breast cancer does not always cause pain. Lastly, four, not all breast lumps are cancerous. Understand this truth is critical for early detection and better outcome. So, what can we do to combat this myth and raise the awareness? My thought is we can support breast cancer awareness campaign and take part in educational program. What is your thought? Please comment below. I also think that we can share knowledge about breast cancer with your friends and families. I also encourage each of you to perform regular breast self-exam, schedule clinical screening as recommended, teaching the people you know about breast cancer myth. Together we can make a difference in the fight against the breast cancer. Let's remember that knowledge is power. By unmasking this breast cancer myth, we empower ourselves and our communities to detect breast cancer early, leading to better results. Before we finish, please support us by liking, subscribing, and sharing this important information with your friends and families. Let's break this myth and help everyone learn more. Until next time, stay informed, stay alert, and keep spreading awareness.